How does an artificial urinary sphincter work for urinary control? Imagine a tiny device inside your body that helps you regain control over your bladder. That's what an artificial urinary sphincter does. It is a specially designed implant that helps men who have trouble controlling their urine, often after prostate surgery. This device works like a natural sphincter, which is a muscle that keeps urine in the bladder until you are ready to go. The main parts of the artificial urinary sphincter include a cuff, a pump, and a pressure-regulating balloon. The cuff is a ring filled with fluid that surrounds the urethra, the tube that carries urine out of the body. The pump is placed in the scrotum, the pouch that holds the testicles, making it easy to reach and operate. The balloon, called a reservoir, is implanted in the abdomen and holds fluid to help regulate pressure within the system. When the device is in its resting state, the cuff is inflated with fluid. This causes the cuff to squeeze the urethra tightly, preventing urine from leaking out. It acts just like a healthy natural sphincter, keeping the urine inside the bladder until you decide to urinate. When you want to go to the bathroom, you gently squeeze the pump in your scrotum. This action transfers fluid from the cuff into the balloon reservoir, causing the cuff to deflate and releases pressure on the urethra. With the cuff deflated, urine can flow freely out of your body. After you finish urinating, the fluid slowly moves back from the reservoir into the cuff over a few minutes. This reinflates the cuff, squeezing the urethra again and preventing leaks. The process is controlled by your manual action on the pump, giving you the ability to manage your urinary flow. The implantation of this device is a surgical procedure that usually takes between 1 and 2 hours. The cuff is placed around the urethra near the bladder neck. The balloon is positioned under the abdominal wall, and the pump is inserted into the scrotum. The surgery is typically done under general anesthesia and is often recommended for men who experience moderate to severe urinary leakage after prostate cancer treatments like surgery or radiation. This device is considered a highly effective option for restoring urinary control. It helps improve quality of life by reducing or stopping leakage that can be embarrassing or physically limiting. However, because it is a mechanical device, it may need repairs or replacements over time. Proper patient selection and surgical skill are important for success, and patients need to be able to operate the pump manually for the device to work well. In summary, the artificial urinary sphincter works by mechanically closing the urethra to prevent urine leakage and then opening it when you want to urinate. It offers a reliable way for men to regain control after sphincter damage, especially following prostate surgery. If you are considering this option, it is essential to discuss it with a healthcare professional who can provide personalized advice based on your specific situation.